We shall start with a case discussion. First,
this point of the upper trunk of the brachial plexus is known as the Erb's point, which involves ventral rami of C5 and C6 spinal segments. The suprascapular nerve and the nerve to subclavius originates from this point. Any injury to this Erb's point leads to a condition which is known as Erb's Duchenne's palsy. The injury to the Erb's point, it can occur due to difficult childbirth, that is forceful depression of the shoulder of the fetus when the head is turned to the opposite side during delivery, or there can be any trauma to the shoulder. It can be a road traffic accident where mainly the shoulder is involved, or any gunshot injury. Nerve involved are suprascapular nerve, nerve to subclavius, the musculocutaneous nerve, the axillary nerve of the supraspinatus, infraspinatus, deltoid, brachialis, that is medial major part, teres minor, biceps brachii and subclavius. Now with the help of this diagram, I shall demonstrate the muscles involved by the nerve injury, and as a result of which the motor loss. That is, first appearance, if you see, the arm is hanging by the side of the trunk, which means the arm is adducted. The adductor at the shoulder joint are the deltoid and the supraspinatus. The deltoid is supplied by the axillary nerve, and the supraspinatus is supplied by the suprascapular nerve. The elbow is extended. What are the flexors of at the elbow joint? They are the biceps brachii and the brachialis. Both of them are supplied by the musculocutaneous nerve. Here there is injury to the musculocutaneous nerves, as a result of which the flexors of the elbow joint are not functional, and due to this the extensors gain an upper hand due to their unopposed action. The main extension at the elbow joint is triceps brachii. As a result, you can see this appearance, which you can appreciate is the pronated forearm. Generally, in normal case, the biceps brachii is a strong supinator. The biceps brachii is also known as supinator longus. The musculocutaneous nerve supplying the biceps brachii is injured, as a result of which the supinator action couldn't be done. There is pronation action, which is due to the unopposed action of the pronators, pronator teres and pronator quadratus. The suprascapular nerve supplies the infraspinatus and the teres minor, which are responsible for external rotation of the arm. Now damage to this suprascapular nerve be internal rotation due to unopposed action of sternocostal fibers of pectoralis major and latissimus dorsi. The wrist and the fingers. If you see this thing, there is flexion at the wrist joint and flexion at the level of the fingers. The flexion is done by the flexor carpi radialis, the flexor carpi ulnaris, the flexor digitorum superficialis and profundus. All these are part of radial nerve. Since the extensor muscles are being damaged, and the flexor muscles gain an upper hand, and as a result you can see this appearance. The person stands with his arm by his side of the body, the forearm is extended and pronated, and the wrist and fingers are flexed. This classical physical position is known as the waiter tips or the policeman's tip hand. Now, there will also be some sensory loss associated. The area affected are the lateral side of the arm and the forearm. And the sensations are the deep sense and superficial sense. Deep sense means the patient won't be able to feel any muscle pain, joint sense and pressure sense. And by superficial sense, that is, the patient won't be able to feel any light touch, pain, pin prick and any temperature change. And there will also be loss of rounded corner of the shoulders due to atrophy of deltoid muscle. The trophic changes. First, the vasomotor changes, that is, the affected area will become red and hot. Why? There is vasodilation. And there will also be interruption of cholinergic sympathetic innervation to the sweat gland, as a result of which the pseudomotor change which will be observed is the skin will become dry and scaly. As you can see, the erectoris pylorum, which is responsible for goosebumps, it will lose its action, there won't be any goosebumps, and this is the pylomotor change.
case of Erb's Duchenne's palsy.
The investigations are the X-ray of the chest to rule out clavicular or humeral fracture. MRI of the shoulder may demonstrate shoulder dislocation or presence of pseudomeningocele, which indicates avulsion injury of the affected spinal roots. CT scan of the shoulder may demonstrate shoulder dislocation. Presence of pseudomeningocele indicates avulsion injury of the affected spinal root. EMG or nerve conduction studies presence of fibrillation potential, which indicates denervations. How will you manage this case? The management is further divided as supportive management, that is by physiotherapy treatment. The stage 1, that is the first 2 weeks, the goal will be to educate the caregivers on how to handle and position of the child. It is dependent on the hand position. The parent should hold the arm in supination and external rotation and place small pillow or folded towel under armpit alongside the arm when the child is resting or sleeping. Dressing, start the affected arm, and for undressing, start with unaffected arm. Avoid picking up the child by the arm or from under the armpit, since it can cause compression or stretch the brachial plexus and cause further injury. Stage 2, that is from week 2 to 4 months. The goal will be to increase the range of motion sensation and the muscle strength. And stage 3, that is from 4 months to 6 months, the goal will be to maintain the ROM, that is range of motion, sensation, muscle strength, to gain milestone and age appropriate skills, to prevent joint contraction and deformity, and continue the same program of the above stage. From 6 months to 1 year, continue the same progress from the above stage, and as the child grows, strength and coordination are increased by active use of the affected arm, using a variety of developmentally appropriate activities and specific functional skills. The surgical management is, in a patient with Erb's palsy which shows no signs of healing by about 6 months of age, or the healing process is too slow or inadequate, surgery may be an option to restore movement and filling. 3 common treatment or surgical treatment for Erb's palsy are: first, nerve transplants, which is usually done from the opposite leg, subscapularis releases, and latissimus dorsi tendon transfers.